I had left the Marine Corps after 9 years, was in human resources for 3 years, find myself not really going anywhere. I felt like I was in a dead-end job, sitting in an office, 40 hours a week doing nothing. I started at school at Rend Lake 2010 in the CNA program. I was looking for something to do that was going to give me a chance to actually make an impact somewhere.
I started nursing school in 1976. I first attended Rend Lake College and got my associate degree here, and then transferred to SIU at Edwardsville. We were definitely breaking the gender barrier getting into nursing.
Originally coming in, I thought there would be like a stigma, not only from friends of mine coming from the Marine Corps into the nursing program, but people were really receptive of it. When you get into the hospital or any kind of the nursing field, everybody is really receptive for the male nurses coming in.
I think patients would be happier. I think physicians would like to see that. I think because of a lot of their personal characteristics, that the more men we could get into nursing, the better.
Nursing is not looked at as a gender-specific profession anymore.
The perception in the past has somewhat been that it was more of a feminine work role for men. I think that's changing now to where it's seen as a professional role that men can get into and be very successful at.
Now I think it's more readily acceptable for men to be in nursing. There's a much higher percentage of men going into nursing and men staying in nursing. Many of the departments such as ICU, the emergency room, many of the critical care areas have a large percentage of male nurses working there.
There was 5 of us in the ADN program this year. I think there was 4 of us in LPN, not as many as I thought there would be, I think. Originally coming into it, I didn't think there would be very many at all, but then the more research I did into seeing things in the hospital, there's a lot more males in the field than I originally I thought there would be.
When I first started working at Good Samaritan Hospital in 1980, there were maybe 5 male nurses working at the hospital total. And now there are sometimes that an entire shift in ICU or ER is almost entirely male.
I think nursing is a great profession for men. I think more men need to think about it. You can come in on the level as a registered nurse and work as a staff nurse, but you can go into education, you can go into business, you can go into, to management. And I don't know any other occupation out there or profession that will allow that amount of versatility. And it not only allows it, but it's viewed positively.
More men should consider a career in the nursing field because it's an option. There are so many different fields you can go to and different avenues you can take through the nursing program. You don't have to be just a clinical nurse. You can be an OR room nurse. You can be an ER nurse. You can be, in intensive care.
There's also the administrative side, the research side. And so there's many avenues for nurses to look at and explore.
I've been able to help people, whether it be just that person that's there for maybe a cold, or somebody who's in a really ill spot, or even a family member, being able to speak with them and to educate them on something that's going on with their family member, and seeing the impact of someone being sick to progress to being actually discharged out of the hospital is something that's very rewarding.
It is a very satisfying profession. I have taken care of patients that have come in that were near death, and weeks later they have come in to thank me for what I've done. And that is just so gratifying to be able to do that. Rend Lake provides an excellent nursing education for an associate degree RN, and provides a good basis for those who want to continue on to get their bachelor's degree or master's, even a PhD in nursing.
The Rend Lake College nursing program is very rigorous. You're required to learn very in-depth knowledge in all the body systems, how to pass medication and understand those medications' use, the side effects, and how they affect the body. There's also a lot of knowledge that you have to learn about how to interact with other members of the healthcare team, because it is more than just physicians and just nurses. You have to be able to work with physical therapists, occupational therapists. And so we're giving a very wide range of information to our students in a very short amount of time. We're committed to putting out high quality nurses that are able to provide exceptional care to the patients, but also work well with the physicians and other members of the healthcare team.
Whether you're a man or a woman and you're looking to make a solid impact in somebody's life, the nursing program is a very, very good option for that. Rend Lake has definitely got me started on that path, and I can see the rewards that is already coming to fruition for me.